So I'm going to talk to you briefly about a totally different type of research, and that's implementation research. Is anyone familiar with that? Great. Okay. I start with the primer. So implementation research is not limited just to mental health care or healthcare in general. It's also been used for, it's also referred to in the past as operations research. And it's been applied in engineering and in other biomedical sciences. And more recently, it's a new science to look at healthcare interventions and how they work in practice. I'm not going to read the quote, but this is, if I were to define implementation research in a nutshell, in English as it applies to health, I would use this quote. So it's how do you actually take an intervention in mental health care and implement it in routine practice. I think that it basically emerged out of the findings that if you look across time and you look at a lot of the biomedical studies or intervention studies that are out there, many of them don't actually translate into being used on a daily basis by healthcare professionals. And this is one such example. Science and Nature are the top scientific highest impact factor journals. And out of 101 biomedical studies, only one actually made a real difference in clinical work when they did an analysis of this over 20 years. And this is kind of just to show you visually, to map out the pathway of different types of research. I would say that if I use my own career as an example, I first started my research career in neuroscience and looking at visual cognition and using eye trackers to look at visual movements. But I wasn't clear how to actually use that in my daily work as a psychologist. So then I left to go work on clinical protocols for different types of mental health conditions, so depression, psychosis, and substance misuse. We formulated lots of recommendations for the healthcare systems in the Netherlands, in England. And then you find out when you do research on how much those recommendations are used in practice, you find that only 30 to 45% of people actually are getting care in line with those recommendations. 30 to 45%. So if you have these beautiful recommendations and something totally different in clinical practice is happening, then the question is why? Why are these interventions working? Why are they being delivered? Why are they not being delivered? What can we do to actually change that and make sure that, for instance, psychologists are delivering cognitive behavioral therapy in a way that's mentioned in the clinical guideline? This is the area of implementation research. So you might be familiar with efficacy studies. Which is typically if you were to test a medication, let's say for schizophrenia, and to test whether it works or whether it does not work, that would be an efficacy trial. Once you've demonstrated that this medication works, you then want to actually see how it's implemented, how it's delivered in routine practice. Does it matter if the professional gives the medication in a certain method, whether they have a certain type of consultation or ways of discussing the medication with the patient? Does it matter what financial mechanisms are in place for reimbursement of the medication? That's more looking at implementation dimensions. Scaling up is a little bit bigger. That's showing, okay, you know that the intervention works. You now know how it works and in what context. Now this is ready to be implemented at a whole country level or a national health system. And it's very clear how that intervention will keep going over time. Clear so far? Yeah. So just to take a step back to the efficacy study I just mentioned. Efficacy studies are intervention studies that we look at in very controlled environments. We have very strict protocols on how to carry out the research study. We have very specific samples in terms of participants that we can test or look at the intervention impact in. And the goal is to really look at, does the intervention work or not? Effectiveness trial is a bit different. That's using more the intervention in real-world practice, interviewing healthcare professionals, interviewing patients who receive the intervention. There's a little more flexibility in your research protocol. And there the idea is to look at the factors that affect implementation. Amita, please feel free to add if you want. Okay. So within implementation science, it's important that you make two important distinctions. The first is between the intervention and its implementation strategy. So a good example is the intervention, let's say cognitive behavioral therapy delivered on an app, an application, a phone application. So that would be the intervention. The implementation strategy would be, how do you give training to healthcare professionals to use the application with patients? In what format and how many sessions on the app work best for the patient using it? Does it matter if it's on a web browser or should it actually be on the phone? Is an online or offline module best? Who's going to pay for the application? It sounds like common sense, and in a lot of ways implementation research is. I just more or less covered this, so I'm going to skip that. Implementation research is the broad umbrella term for this whole domain of research, but the methods that you actually use within it are the same that you would anyways use in your other areas of research. So it can be quantitative methods that you look to answer your research questions. It can be quantitative surveys. It can be randomized controlled trials. It can be adaptive randomized trials, for instance, a stepped wedge trial design. I won't go into that. And it can also be qualitative research. So you can do focus groups, you can do interviews, you can look at chart reviews from patient records. You can do economic evaluations, which are largely quantitative. You can even do literature review or media analysis. So the methods are not innovative itself. It's the questions that you ask that relate to clinical practice that are part of implementation research. This is just to give you a few examples of what implementation interventions would be. It's usually looking at very complicated things that are hard to change, like our behaviors. So for instance, behavior change interventions at the patient level, at the healthcare practitioner level, at the system level. What barriers and facilitators exist to actually making a treatment or a service functional? What concrete advice can we give to policymakers to actually make more evidence-informed decisions? What kind of quality and performance indicators help this intervention to be used and measured? And even an intervention can be having a goal to, for instance, help people implementing services, so people like psychiatrists or heads of wards or heads of hospitals, to understand how to improve the services that they provide. I'll give you an example of an implementation research project that I'm currently working on together with a large consortium in 5 Central Eastern European countries. The intervention is building a community mental health team for severe mental illness. And it's the service model that is the intervention. What we also want to look at is how effective was our implementation strategy. So we train the community mental health teams. We provide a supervision and monitoring, year of supervision and monitoring after the training. We make progress roadmaps. We carry out audits, and we give information about the results of the audits. That's the implementation strategy. And we want to evaluate both. To kind of help our thinking with what kind of factors we think will be important to affect implementation, what kind of study design we want to look at. We usually refer to an implementation framework, a theoretical framework. There are literally hundreds, and you can pretty much open the Journal of Implementation Science and read about new frameworks emerging all the time. But in our projects, we tend to use one that's very easy to understand because it's a framework often used for public health interventions to look at the impact of it. I'll wait till the sound goes. And that's the RE-AIM framework. The RE-AIM framework is used, I think, in countless mental health but also other public health interventions. And it looks at different dimensions of the implementation process that you should be consider or pay attention to. The R stands for reach. That's how successful or to what extent did your intervention actually reach the target population that you planned for it to. Effectiveness is how well does your intervention work when it's implemented in a new healthcare setting, for instance, in a new family doctor practice, or in a new setting, maybe digitally instead of face-to-face. Adoption is, okay, how much was the intervention taken up by those delivering it? Did psychologists actually take up the intervention after you trained them in how to do it? And why or why not did they take up those responsibilities? Implementation is the consistency of the implementation process. So let's say you build a community mental health team and that's the intervention. Implementation says how, when they actually start to work and practice, how closely do they follow the method you trained them in? Where are the deviations? Why is there deviation? And it's also looking at, did the community mental health team maybe adapt what you trained them in to maybe work better for them? And what steps did they take to adapt what you trained them in? The last is maintenance. I would say an easier way to look at that is sustainability instead of maintenance. But it basically means to what extent is the intervention and its implementation process likely to be sustained over time. Is there a plan for addressing the cost? Is there a plan for addressing motivation of the workers delivering the intervention? How long is this likely to be sustainable for? I won't go through this, but this is just some example research questions that you might have in an implementation research project. These are a few references. I tried to keep it very brief because I thought it would be a new field for many people. I would say that it's the last 10-15 years that this type of research has been carried out in the context of mental health, so it's pretty new. But it's really been helpful to help us in, for instance, when we're thinking about a reform of mental health services in the country, to make different decisions, to know what kinds of interventions work in different hospitals or family doctor practices or not, to know if training actually works or not. And it's a lot of reading, so if you're interested more, I would suggest to look up some of these references or just to look at the Journal Implementation Science, which is open access, and just to select a few papers that might be interesting to you. So, thank you very much for your attention.